Okay, so I've been getting a lot of referrals lately from doctors sending their patients in with heartburn, gastroesophageal reflux disease, and the patients are wondering why. Why are they sending me here? Do you treat this? No. But so why are they sending me? And I think this is a very important thing to discuss from a doctor's perspective, understanding what we are doing as chiropractors, and the patient understanding my role and what I'm doing for them and how I am taking care of you. And I think there are two perspectives to look at this from. The first is chiropractic. How does chiropractic help? Kind of, like a medical doctor. There's a chiropractor who is like a medical doctor, let's say, an analogy. And then a medical doctor has medicine, which would be our chiropractic. A medical doctor doesn't always use medicine. They have a scope of practice and things they can do. They could even use surgery, etc. So let's just say chiropractic, we're talking about the adjustment. So I'm going to be checking your spine for subluxation to look for interference in the nervous system. Adjust your spine so that your body's behavior improves by improving the function of your nervous system. That's what chiropractic is. Does that help with heartburn? Okay, and the chiropractor, who's an educated professional who can do things outside of that in their scope of practice to help you. I could, for example, prescribe an antacid, an over-the-counter antacid, Tums or something. I probably wouldn't. I wouldn't do that, but I could. So I probably couldn't do anything really that you couldn't do yourself at a drugstore, but you would have my expertise possibly guiding you as well for what that's worth. So there's that. But from a chiropractic perspective, let's just look at that and how that might help. And no, as in terms of chiropractic, the goal of chiropractic is not to treat your heartburn. It's not to make your stomach feel better. But what we will do is actually use that information that, if you do have heartburn or if you do have those symptoms, we will use that to figure out how to help you. So for example, this poster, which you can actually see, you can make one out just to my right over there on the wall. It looks like this. Here's your spine, and these are where all your nerves are that control, for example, these are all the segments of your nerves, and this is where they go to the different parts of your body. So these are all things that we treat. Down in this column, if you have a headache or neck pain, that's very directly related to that. But oftentimes you'll have other issues that will also direct me toward issues with your spine. So if you do have a problem with your stomach, I'm going to pay very close attention to your upper back, because from a traditional chiropractic perspective, a subluxation-based chiropractor is not going to treat your stomach. They're not going to treat your organs. And this is a very important point because we just aren't treating that. But I am not going to ignore it. I'm going to use that information, that review of systems as we call it, because I'm a more medicalized chiropractor by training. We're going to use that review of systems to guide us towards your care holistically, functionally. But it is, from a traditional perspective, I'm going to look at it and say, well, I got to check T5, T6, T7, because those are where the nerves are that go to your stomach. And you know what? Sometimes, it might work. I don't know. If you do have an interference with your nervous system in that spot, will it affect your stomach? I don't know. Do you know? But in order for it to be a treatment, it would have to work a lot of the time, more than a placebo. And I don't know whether it does work more than a placebo. I don't know. I haven't done the studies. And it doesn't really matter to me, because what I know is that for many people, when I adjust them, they walk out. And two of them are medical doctors themselves, and they refer their patients in when they have heartburn because they notice that when I get adjusted, it improves my heartburn. Now, it may not be because of this. I'll go over some other things as I sort of address how, as a physician, I'm actually going to formulate and investigate to see what's wrong and could potentially be causing problems, because it's more than just the subluxation. It's more than that. So we'll get to that in a moment. But I do want to make sure everybody understands that from a traditional chiropractic perspective, our goal is to treat the spine. All those other things, if you have stuff out here, you're gonna circle it on the form, and I'm gonna go straight to your spine and go, well, how's the spine? And if it's okay, then it's okay, but I am gonna take these body signals and use them as evidence to investigate problems that might be with the spine and see if I can associate that and see if it makes sense that one could be related to the other. Because you could have a problem with your stomach that's causing reflex actions in your body, what's called a viscerosomatic pain, and referring into your upper back, and that could cause muscles to tighten up. So it could even happen the other way around. But either way, we want to know the association. It doesn't mean that I'm treating the stomach. I'm definitely not, because that's not my job. My job is to look at you holistically and take care of you and help you make you as healthy as possible by improving the function of your spine and your nervous system. And it's as simple as that. But there's more to it than that, because even though, there is that chance, possibly, whether you consider it significant or not, there is that chance that the adjusting for subluxation is going to directly help that way. There are lots of other things that can affect you and cause heartburn. So it could be, for example, your posture. If you have a slouching posture, that's going to put pressure on your diaphragm. It's going to put pressure on your stomach. Okay, that's going to affect the position of your diaphragm against your stomach, and it could cause problems. So changing the actual movement of the ribs, you doing soft tissue work around the diaphragm and around the ribs sometimes makes sense. If somebody has heartburn, maybe it's a good idea, I think, to make sure that we're addressing those issues. It's a good idea to address those issues anyway. But if you're getting heartburn, it seems like even more of a good thing. Now, can we trace it back to stress? If you're getting GERD, it may get worse when you're under stress. So where would those stresses come from? It could be an emotional stress. That would actually change your posture. Okay, if you're emotionally, your body changes based on your emotional state. So that is a big thing. And then there's chemical stress. If you're drinking 8 liters of Dr. Pepper every day, well, that could be the reason why you're having problems. So taking away sources of chemical stress, normally with gastroesophageal reflux disease, it's going to be fatty foods, alcohol, nicotine, chocolate, mint, and caffeine. So those things typically are going to cause a weakness of the esophageal sphincter, and then you get things bubbling up into your esophagus, and then a lot of things are uncomfortable. So one analogy, I guess a good way of looking at it, even though we don't treat that, let's just say you have type 2 diabetes, okay, and your doctor says you need to get more exercise. So you go to a personal trainer, and your personal trainer is helping you exercise, and he's helping your diabetes. He's helping you with your lifestyle to exercise and do these things to make you healthier. A chiropractor's similar to that in a sense that we're not necessarily treating those problems, but what you're doing by taking care of your body is going to improve your life, improve your lifestyle, and make you healthier. So it may elevate your health to the point where it overwhelmingly makes you less susceptible to that problem happening. So I hope you found that interesting. Bye.